everyone. I am Dr. Sudha, Ophthalmology faculty on the PW Meded platform. And in this video, as a part of the Residency Explorer series, I will be discussing about the pros and cons and the scope of ophthalmology as a branch. Now, before we begin, the first thing I would like to tell any NEET PG aspirant or a student who has got a rank is, what are the things you should consider before you choose any branch? Now see, I believe that there are two things that we have to consider before we take up any branch. Number one is whether we actually have an interest in that particular subject, right? Because this is something we have to do for the next maybe 30 or 35 years of our life. So every day morning you have to get up and you should feel like going to work, because if that is not the case, then you will burn out very, very quickly. So you have to have an interest in that particular branch. Second is whether it is actually sustainable. And by this I mean that, see, initially everybody has a passion for a particular subject, but then there are some subjects which demand a lot of dedication and commitment and sacrifice from not only the person himself or herself, but also from the family members. So if you have chosen such a demanding branch, like say for example, if you've chosen like neurosurgery, whether you will be able to carry on this passion for the rest of your professional life, and you should also ensure that the people who are important to you, that is the family members, are also on the same page, whether they also understand this is what that you are getting into and this is what they have to be a part of, right? So these are the two things you have to consider before you choose any branch. Now let's come to ophthalmology as a branch. Now, I feel that ophthalmology has a very nice blend or a very nice mix of both medicine and surgery. So like there are some of us who are like geeky, who like differential diagnosis and investigation and like narrowing it down to a particular diagnosis. So ophthal has a little bit of that if you do things like say maybe uveitis, and a large part of it is surgical. You like doing things with your hand, you like procedures, you like surgeries. So ophthal has a mix of both. So it has a little bit of medicine and a little bit of surgery, which I feel that makes it a very, very interesting subject. Second is that most of ophthalmic surgery, cataract, and it is a microsurgery, which is again very, very exciting. It is exciting to learn, and there are lots of advancements that are going on in microsurgery, in ophthalmic instruments. So it's a very, very technology driven field. So those of you who like technology and definitely enjoy this, and there are innovations happening at a very, very rapid pace in this field because it is largely technology driven, infrastructure dependent. So that is one of the good things about ophthal. There's never a dull moment, something or the other is constantly happening. So this is what I feel makes ophthal interesting, and this should be good enough reason to choose the subject. Now, the next thing that people often ask is, what are the pros and cons of the subject, right? So if I were to talk about the pros, there is enough scope in this field because see, the bread and butter of an ophthalmologist is cataract and it is refractive surgery. Now cataract, the most common cause of cataract you all know is senile cataract. So it is like a geriatric problem. So now as long as people will grow old, there will be cataracts and there will be work for the ophthalmologist. And because now the life expectancy is kind of increasing, there will be more people who will be getting cataracts and there will be more work. So just like we say that obstetricians will never run out of work, similarly it's kind of same for ophthalmologists also. And the other is refractive surgery. Refractive, and now you all know how common refractive errors are, and with a lot of cosmetic awareness that is coming into place, refractive surgeries are also it's a booming field that way. So there's a lot of scope in this field. And apart from that, if you really want to choose some subspecialty, like for example, you can choose to be a cataract and refractive surgeon, you can choose to be a vitreoretinal surgeon, you can choose to be a squint surgeon, a pediatric ophthalmologist, you can choose neuro-ophthalmology as your subspecialty, you can choose to be a cornea and transplant surgeon. So there are a lot of subspecialties to choose from, and there is a lot of scope in the subject that way. The second thing about this subject is it's a very rewarding branch because, like for example, as I told you, the commonest surgeries are cataract surgery, refractive surgery, and they have very good and predictable outcomes in good hands. So therefore, whatever you promise to the patient, you will be able to deliver it most of the time. So most of your patients will be like happy patients. So you will enjoy doing it. Now, if you look at maybe subspecialties like vitreoretina and glaucoma and cornea, the prognosis is of course guarded in these, but then these patients anyway have very, very poor vision. They are not able to see at all. So whatever little bit of vision you are able to restore to them, that is really a gift to them. So they will also be generally happy. So that way I would say that it's a very rewarding branch. Whatever work you do, your patients generally tend to be happy with you. Next is that about work-life balance. Apart from trauma, and if you choose to be a vitreoretinal surgeon or a cornea transplant surgeon, that's a different thing. But apart from these, it is largely an elective branch. Most of the surgeries, most of the procedures can be planned and it can be carried out in an elective manner, which means that you can limit your practice hours to what you want most of the time. So, like for example, this gives you a good work-life balance if you want to do something else, whether it is nurturing a hobby or you want to do something else. Like for example, I enjoy teaching. So I choose to keep my practice hours elective and then I can devote the rest of my time to teaching. There are others who may want to pursue other hobbies, so you will be left with enough time for this. Once you have, of course, passed the hurdles of residency and fellowship and you've settled down as a consultant, you will be able to take the shots, which may not be really possible with specialties which have a lot of emergencies, and therefore you will have to be available for more number of hours during the day and even maybe during the night. So in Ophthalmology, that is, I would say, a great advantage of being able to limit or choose your working hours so that you can have time for other things. But of course, at the same time, if you really want to be a hotshot PR surgeon or a transplant surgeon and you can have a roaring practice, that's also possible. So it's a call you take. Either you want to do elective work and keep limited working hours, or you really want to be roaring practice and you want to work round the clock, that's also possible. So that is a call you have to take. So these are like the advantages of Ophthalmology. Now, if you come to the cons of the subject, that is, what are the disadvantages? The main disadvantage, I would say, that it is largely an equipment-based subject or a specialty. So you need a lot of instruments, the basic instruments that you need, like the OPD setup, which consists of a slit lamp and a refraction unit, the basic OT setup, which consists of an operating microscope and a phaco machine. Then the other investigative modalities like a perimeter, an optical coherence tomography, and other equipments that you need. There is a huge lot of capital involved if you want to set up your own practice, which may not be very feasible in the early years of practice for most of us. That is so, it may require you to work in an institute or in a government place for a few years, and then maybe you can start thinking about setting up your own practice. The second is that, like all surgical branches, it has a learning curve. So you immediately after your PG, you may not really be in a position that you are really confident of your skills, and people start appreciating and people are ready to believe in your skills or trust your skills. So like all surgical branches, there is a learning curve. You will need to do a fellowship in some good institute, or you will need to do a senior residency in a good hospital so that you can hone your skills before your hand really becomes ready for practice in private. This is not the problem with just ophthalmology. I would say that this is an issue that is there with all surgical branches. There is a certain lag time between the time you complete your residency and your practice actually takes off. So apart from this, I would not say that I can think of any cons as such. So these are like the pros and cons of the subject. Now, there is a question that often comes up: is this an end specialty? So now, after all these things that I've told you, you would have realized that it is no more exactly an end specialty. There are certain subspecialties in which you will have to hone your skills after your PG. You can of course choose to be a cataract and refractive surgeon. You can do a senior residency in a good government hospital, or you can do a fellowship in phaco-refractive surgery from some good private institute. You can choose other subspecialties like glaucoma. You can choose to be a squint surgeon and pediatric ophthalmologist. You can choose to be a cornea and transplant surgeon, or you can choose to be a vitreoretinal surgeon. So there are subspecialties in which you you need to do fellowships or you need to do a residency from a good government hospital to hone your skills. So it is not exactly an end specialty now. Like at the end of PG, you don't like learn everything and you're ready for practice. That doesn't happen. So now what is left is from where should we do the residency? What are the good places? Now there are two options for ophthalm residency. You can either do an MS or a DO from a government place, or there is the option of doing a DNB. Now, as I have been saying throughout this video, that ophthalmology is largely an infrastructure dependent or it is equipment dependent branch. So if you get an MS or a DO from a good government hospital where all these equipments are present, like for example, you should have an operating microscope, you should have phaco machines, residents should be getting enough hands-on on phaco or cataract. You should have slit lamps where residents are able to examine patients. You should have other equipment like perimeter, OCT. Only then you will be able to learn all this. So if you get MS or DO in a good government place where all these things are present, then it is obviously you should choose it. But if you are getting MS in a peripheral government hospital where equipment is not really available, then it is much better to choose DNB, because many of the DNB granting institutes have excellent infrastructure in ophthalmology. You will have all exposure to all kinds of instruments, and you will get to see the best in ophthalmology. So as far as ophthalm is concerned, an MS in a peripheral hospital is probably not as good as DNB in a good private place. So that is something you have to really consider before you pick your seat. So, and like all specialities or all, you have to, before you take any seat, do find out about the place, whether the all equipments are present, whether residents are getting enough hands-on on cataract surgeries, and you talk about the work culture in that particular place, how your seniors are feeling, whether they are satisfied. You find out, because it's very important that you have to choose the residency in a place which has the right environment, the right academic environment, the right teaching environment. You get enough cataract surgery exposure. You get to at least see the other type of subspecialty surgeries. And then only you should choose that particular college or institute for your post-graduation, right? So this is what I wanted to share with all of you. So I hope those of you who have an interest in ophthalmology have understood a little more about the branch, and those of you who have been thinking about choosing ophthalmology as a branch have got some clarity about the scope of the subject in future. But as I said at the beginning of the video, it is very important that before you choose a subject, do ask yourself whether you have an interest in this particular subject and you will be able to sustain it for the rest of your professional life. And if ever you have a confusion between branch and the college, always go for the branch. Because see, the college is going to stay with you only for 3 years, but the branch is going to stay with you for the rest of your professional life. And if you really do not get to hone your skills entirely in your residency, there are ways of honing it later also. But once you've done a residency, it's not possible to change your branch. So never choose the college over the branch. You have to choose the branch only. The branch you first decide and see out of the options which is the best college where you are going to get your branch. Right? So I hope this has been able to help you all, and all the very best to all of you. Thank you.